Hi, in today's video we're going to continue our ICD-10-CM chapter specific coding guidelines. So in this video we'll be seeing about the chapter 5 mental, behavioral and neurodevelopmental disorders, series F01 to F99. So let's dive in. This is Surya Johnson, your medical coding guide. In today's video, the chapter 5 mental, behavioral and neurodevelopmental disorders F01 to F99 series. Let's get straight to the chapter. The first one, A, pain disorders related to psychological factors. So if the patient has a pain that's exclusively related to the psychological disorder, we will be assigning F45.41. So what is F45.41? It is chronic pain disorder with somatic and psychological factors. So under this, actually these are all straightforward diagnosis. There is not much explanation or things to look into. Under this, there is an exclude one node under category G89. What is G89? G89 is pain not elsewhere classified. So this code cannot be given along with F45.41 because it's an excludes one node. So if you've already seen my previous video about the conventions, you would have known already what is an exclusive one means. So if there is an exclude one below any of the codes, you cannot give them together. So there is another code F45.42, which is pain disorders with related psychological factors, should be used with the code from category G89, which is pain not elsewhere classified, if there is a documentation of psychological component for a patient with acute or chronic pain. So what does that mean? If the pain is exclusively because of the psychological disorder, only because of the psychological disorder the pain is there, then it should be F45.41 and it should not be coded with G89. But if the pain is related with, there is a pain disorder, there is already a group of pains already there in the patient's body with a related psychological factor, there is this relationship with the psychological factor, but this is not the only reason for the pain. In this scenario, you will be coding F45.42 along with G89. From that category also you can code when there is a documentation. So the next one, B, mental and behavioral disorders due to psychoactive substance use. Let's consider the patient has some psychotic substance use and because of that there are some mental and behavioral disorders. In that case we should follow some criteria. When the patient is in a remission status. So if the patient is in remission status, how do you choose the codes? You choose the codes from the category that has the word remission, in remission, that describes the code that describes in remission status. So, you will be choosing from F10 to F19 if the patient is in remission status. And how you will know the patient is in remission status? It is only purely by the provider's judgment, by the doctor's judgment and documentation. No other classification unless there is an official guideline can be considered. So, for example, if the patient is already in remission status, but the patient is using mild substance, in this scenario you will be coding the substance abuse in remission. So, substance abuse in remission will be coded for mild substance use. If the patient is using moderate or severe substance, then in this scenario you will be coding substance dependence in remission. So, when the patient is using mild during in remission phase, you will code it as substance abuse in remission. If the patient is going for like moderate or severe substance use, then you will be choosing substance dependence in remission. So, the second point to consider here is psychoactive substance use abuse dependence. So, how do you code? Sometimes the patient's documentation, the doctor would have mentioned use and dependence or abuse and dependence of the same substance, like for example alcohol dependence or alcohol abuse. In the documentation the doctor has mentioned the patient has an alcohol abuse and dependence. In this scenario, how to choose? You cannot code both. In this scenario you should follow the hierarchy. So, use will be the first level, abuse is the next level and dependence is the highest hierarchy. So, if the documentation has both use and abuse, so you will go as per the hierarchy, you will code only abuse. You got my point, right? So, if both abuse and dependence are documented, you will go with the next hierarchy, that is dependence. This is how you should choose the code. If the doctor of the provider has documented or referred that the patient has use, abuse and dependence of the same substance, you will find based on the hierarchy. So, the third point here is psychoactive substance use unspecified. For example, there is no specificity about the psychoactive substance used by the patient. In this scenario, you can choose the unspecified code that is falling in the F10.9, F11.9, F12, all these series, 0.9. These should be assigned based on the provided documentation. Also, you should consider this thing should meet the definition of a reportable diagnosis. What does that reportable diagnosis means? Like, this substance use is associated with this substance related disorder. Like, for example, the patient, because of the substance use, has sleep disorder, have some mental or behavioral disorder, or has sexual dysfunction. So there should be a medical condition related to this psychoactive substance use. In this scenario, if there is no medical condition related, you cannot code this one. So if there is some other medical condition related and the doctor has given a psychoactive substance use unspecified, then you can choose these unspecified codes. So the next point, fourth here, is medical conditions due to the psychoactive substance use, abuse and dependence. So for example, we will see there are so many medical conditions that resulted because of the substance use, abuse or dependence, but there is no specific diagnosis that defines that. For example, the patient has some sexual dysfunction. In this scenario, if there is no relative or there is no diagnosis that specifies the patient has sexual dysfunction due to this substance use or abuse or dependence, in this scenario, if there is no combination code, as I have already explained in the convention, if there is no combination code, split it and code. So, you will be coding the medical condition separately first, followed by the substance use or abuse or dependence, whatever has been documented. So, if there is already a diagnosis, for example, alcoholic pancreatitis due to alcohol dependence, the patient is an alcohol dependent patient, because of that which resulted in alcoholic pancreatitis, inflammation of the pancreas. In this scenario, there is a code K85.2 which is alcohol induced acute pancreatitis. So, you will be assigning this code, and then from the subcategory F10.2 or F10.20, which is alcohol dependence uncomplicated. Why we cannot use with other alcohol induced disorder? Because the other is specified here. It is exactly specified as K85.2, that is a pancreatitis because of the alcohol induced. You cannot code other. In this scenario, you will be coding with the uncomplicated if there is a combination code or if there is a medical condition related to the substance abuse, use or dependence. So, the fifth point here is blood alcohol level. So, you will be choosing Y90 for the evidence of alcohol involvement determined by the blood alcohol level test. To choose this code Y90, it is not necessary that the doctor should document in order to be coded, because there is a guideline. This fifth chapter is actually straightforward. You can get the diagnosis directly from the book, but only thing is you should look into the footnotes. What are the things explained there, exclude notes, include notes, and any other notes, include notes and everything like this. So, you should be taking care of those things, and it is very easy to code. So, the C one is factitious disorder. Factitious disorder, it means fake. Like the patient, sometimes they will say like, I have this physical illness, I have this psychological sign and symptom, but the patient will not have it. It's just the patient imposed that they have these signs, they have this syndrome. It's called as factitious disorder on self or Munchausen syndrome. In this scenario, you will be coding F68.1, factitious disorder imposed on self. There is also another kind of disorder, which is the Munchausen syndrome by proxy, that is MSBP. Proxy means another person, a caregiver or somebody who is coming along with the patient, and that person, the proxy person, is giving false reports, like this patient has this kind of illness or injury in this kind of scenario. If that proxy is giving false sign and symptoms or reports about the patient, a child or an elderly adult or someone who has a disability, right, they cannot speak for themselves, should be someone to explain their case. In that case, if the person who is coming along with them, a caregiver or any proxy, if they are giving false illness or injury related things, reports about this patient, you will be assigning F68.8. Now, this F68.8, factitious disorder imposed on another, should be coded not for the patient, should be coded for the proxy, the person, the caregiver who is giving the false information. So F68.A is for that false information giver, that caregiver or the proxy person. So for that patient, how we will be coding for that patient who is having this kind of false reports on them, you will be coding T74, adult and child abuse, neglect and other maltreatment confirmed, or T76, adult and child abuse, neglect and other maltreatment suspected. So if the proxy or the caregiver is the false report is confirmed, you will be coding T74 as an abuse, or if it is not confirmed but the provider is suspecting that whatever the other person, the caregiver is given, the reports given or the things spoken by the caregiver about this patient is false, the doctor is suspecting that one, you will be coding T76. In 2020, they have introduced guideline for dementia. This entire thing has been introduced in 2023. So dementia is coming under D. The ICD-10-CM classifies dementia categories F01, F02, F03 on the basis of etiology and severity. So based on the severity and the etiology of the dementia, these categories are classified F01, F02, F03 as unspecified, mild, moderate or severe. So based on the doctor's documentation, you will choose the appropriate severity level diagnosis. So if the documentation does not provide what kind of severity it is, mild, moderate or severe, it didn't document anything, there is no documentation supporting, what you will code? Obviously unspecified as per the coding guidelines. So you will choose the unspecified severity. So for example, the patient has been admitted in inpatient acute hospital care or inpatient facility setting. So with dementia at 1 severity level, the patient at the admission time had dementia, but the severity level is 1, like for example, we will say mild severe, mild dementia. But at the admission, after the admission, the severity progresses to higher than the mild severity level, then in this scenario, you will be coding the highest severity level during the stay. So that is all about the 5th chapter, which is a mental behavioral neurodevelopment disorder. It's a very small chapter with very minimal guidelines to be noted. Take care of these things also in your daily coding things. So whatever codes are there, even if there is no elaborate guideline for any chapter, just focus on the codes and the footnotes. Then you can land into the correct code. If you like this video, please hit the like button, it will really mean a lot to me. And if you're new to this channel, please hit subscribe and hit the notification icon so you'll not miss any of my future videos. If you have any doubts in this chapter or in coding in general, ask me in the comment section below and I'll try to answer everything maximum. This is Surya Johnson, your medical coding guide.